Welcome back to Community Focus here on Central Kentucky TV. Kenny Fogle here with you, and glad you could join us. We're going to talk about a lot of things on our Community Focus show here in Nelson County, and one of the things we're going to talk about is how to relieve pain, how to relieve a lot of things, and one of the things we're going to look at is chiropractic. And if I say that correctly, I've got Dr. Bart Plant here with me, one of the chiropractors here in the Bardstown area. And first of all, Bart, welcome to the show.
Well, thank you very much, and thank you for having me.
And I know that you've been involved you've been a chiropractor for a number of years.
15 years.
15 years.
I can't believe it's been 15 years already. So,
well, tell us a little bit about what chiropractic is. For somebody that's brand new, never been to a chiropractor before, tell us exactly what it is you do.
Well, basically, it's a natural form of healthcare. We try to focus on the spine kind of as a center of health. Sometimes the joints will lose some range of motion, or they're not moving like they're supposed to. And when a joint loses its motion, it kind of starts the inflammatory process, or the degenerative process. If a joint can't move through its full range of motion, then it can't get the nutrients it needs to stay healthy. So that joint will start to inflame, and it'll inflame the tissues that are associated with the joint. They're called facet joints, but basically posterior joints, and then the nerves that are associated with the joint can get inflamed as well. So it's my job, put more motion into the joint, let the body heal itself, and basically let everything work like it's supposed to.
Now, when I think of chiropractic, when you first think of it, you think of skeletal issues and maybe the nervous system to some degree, but there's more to it. We talk arthritis, fibromyalgia, but is there other things obviously other things are affected by your skeletal and your nervous system?
Well, definitely. It is primarily focused on neuromusculoskeletal conditions, but I'll have a lot of patients that come to me with, my neck hurt, my back hurts. Those are the kind of the things that everybody knows. If my neck or back hurts, then I'm going to go to the chiropractor. But and when they'll notice that while they're coming, maybe I'll help them with their headaches, or maybe we're having some sexual dysfunction things, or a woman's having problems getting pregnant or something along that line. Now, there's not a lot of peer review, double-blind studies that kind of show that, but just kind of the anecdotal evidence that our patients will give us, the things that they're also noticing in their life. Their allergies are getting better, or they're not having many sinus problems, or they're not getting bronchitis like they're supposed to. Basically, if you think of the spine kind of like a circuit breaker to the body, and if those little bones rotate from side to side, they irritate the nerves go out and control everything in the body. So whatever that nerve is controlling, if it's not functioning properly, then it's not going to work like it's supposed to.
Okay, even internal organs.
Oh yes, everything in the body from the smallest hair to your heart to blood pressure, it's all controlled by nerves. And if the nervous system isn't functioning efficiently, then your body's not going to be able to work like it's supposed to.
And this work on your thinking process as well, I'm sure.
It's the D.D. Palmer, who was the original chiropractor. He started Palmer College of Chiropractic back in 1895, I believe. It's been a while.
He's not still around.
No, he's not around anymore. But he had Harvey Lillard was a janitor in his building, and he was a healer at the time. And Harvey actually had a pain in his upper back. He had pain up between his shoulder blades. And that's where the sympathetic part of your nervous system kind of exits out. And Dee said, I studied anatomy and I studied physiology, and you got this pain up here, and I think I got something new. I think I can help you. Yeah. And I want you to kind of lay down on the table. And he explained to him what he was going to do. And he laid him on the table, and he gave him a chiropractic specific adjustment. It adjusted that one vertebrae or that one segment. What I didn't tell you was 15 years early, Harvey Lillard was in I think it was a trolley accident or a streetcar accident on the street. He got kicked by a horse, and he was deaf. Yeah. When Dee adjusted his spine, it basically calmed down the sympathetic nervous system, which is the fight or flight mechanism. It gets us kind of wired up. Yeah. And it let the parasympathetic take over, which relaxes us, it calms us. So the blood vessels opened up, and he could hear. He heard the street trolley, when he got up off the table. And that was when Dee basically said, I think I got something here. And he said, from chiropractos, which means it's Greek, or it's Latin for hand done. And that's where he came up with chiropractic. So,
well, first time I ever knew anything about chiropractic, I was in the Air National Guard, and I was out at a function, and happened to be I was outside and I told somebody I had a slight headache, and there was a guy there, was a chiropractor. I didn't even know that. He walked up to me, so well, here, turn around for a second. He turned around, he manipulated my neck a bit, and he popped my neck just a bit, and the headache went away just like that.
Definitely.
But what I'm leading up to is I mentioned to you a few days ago about a possible patient that said they have the fear of chiropractic because of that very thing. They heard that popping their neck was they don't want to be popped.
Right, I understand. There's absolutely, according to the new research, there is no correlation between the chiropractic adjustment and what they call a vertebral basilar incident, or the big word is vertebral artery dissection.
Yeah. Remember that, there'll be questions later.
Basically, they're saying stroke, but chiropractic absolutely does not cause stroke. In the very minute part of the population, which is usually like a post-traumatic car injury, if your head is turned during the point of impact, it can injure these little ligaments. They're called alar ligaments in the top of your neck. And if that ligament is injured or unstable and it's not properly diagnosed, then yes, maybe something might be able to happen. But as long as you do a thorough examination, you're able to identify the findings, there's absolutely no correlation between a chiropractic adjustment and any kind of stroke issues or anything like that. There's actually more, well, the old evidence said there's more of a chance something going wrong taking an aspirin or a non-steroidal anti-inflammatory or putting your head back in that sink at the beauty salon. But the new evidence says even that is old evidence, that now there's absolutely no correlation. So.
Well, I had somebody asked me a little while back about going to a massage therapist of some sort, but chiropractic goes much more beyond massage. I mean, we'll tell the first, before we even go into that, tell us what kind of education and training you have to have just to become a chiropractor.
Well, when you compare medical school to be an allopathic doctor or a medical doctor, a doctor of chiropractic, or a DO or an osteopathic doctor, basically the hours of the school are the same. Where the osteopathic doctor and the medical doctor kind of differ is they take general surgery and pharmacology, where I take more hours in neurology and radiology because I'm kind of a functional neurologist and I read my own x-rays. If there's something that we need help with, then we'll refer out to a radiologist. And we try to build a team. I mean, I know I can't help everyone, but if what I'm doing is not working how I want, if you're not progressing, then I'm definitely going to refer you on to someone that's going to be able to help you, or get you to be seen by the right doctor or the right therapist, or whatever we need to do. Sometimes physical therapy, sometimes massage therapy. Just whatever you need. We refer and deal with neurologists, medical doctors, pediatricians. We get referrals from pediatricians here in town, medical doctors, and we've probably referred back and forth with most of the practices.
What would you find is one thing, or maybe more than one thing, that would surprise somebody to know about what a chiropractor does or what you can do?
I guess one thing, and I was talking with somebody the other day, and they said, well, when you go to the chiropractor, you have to go forever. I said, well, that's not the case. You come in, you have a problem, we do an exam, maybe take some x-rays, we set you up a treatment plan, we treat you, and then there comes a point where you're doing well. So we can either dismiss you altogether, or we can have you come back periodically for wellness care. Now that's generally once a month. And what I compared it to, or basically I said, when you go to your medical doctor and you got high blood pressure and he puts you on that blood pressure pill, and then you go back in a month for a follow-up and your blood pressure is under control, do you stop taking the pill? And I seen a light bulb kind of go on in his head, and he was like, oh. So it's just basically we're all responsible for our own health, and the more we can do, or I got a lot of people think that health is from outside in, and it's actually from inside out. So we just have to maintain our health, do the right things. We have to change the oil in our car and maintain our house. If you got something nice and you want it to stay that way, you better take care of it. So.
Well, one thing I think a lot of people may not know is just within the past several years, most insurances cover chiropractic now. I think all insurances are required to now, whereas maybe 10, 15 years ago it wasn't the case.
Right. We take basically every insurance company. There are very few that don't have medical benefits. The ones that don't, it's they're called self-funded ASOs, but basically they fund themselves.
Yeah.
But very few. I'd say probably 99% of all health insurances do have chiropractic benefits. Medicare, Medicaid, everything. It's come a long way from when my dad and grandpa were chiropractors. Grandpa, he graduated in 1945, and my dad graduated in 1970. But a lot of the things that they did, I guess, helped to pave the ways for us. And they used to be able to say, oh, they don't have the research, or where's the double-blind clinical trials, or the peer review. Where nowadays, the things that they were saying then, they're actually proven now. We have the research now. Chiropractic works. We've got the proof, and basically anymore, it's not considered a experimental therapy. It's basically we have the proof, and it does really work.
It's become more mainstream.
Yes, definitely.
And the thing is just like any other medical field, it's always progressing. I'm sure you're always learning something new and trying something new.
Now everything's going to what we call evidence-based. So you try to stay up on all the new evidence, and basically you got to read journals and stay up on all the new stuff, and that dictates care. So everything is evidence-based now. So the more evidence that supports this or that, that's what we do.
Well, we appreciate you coming in here today and updating us a little bit about something that we may or may not have known. And hopefully, if somebody's looking to go try the chiropractor, I mean, you're always taking new patients.
Oh yes, we're always accepting new patients. I haven't turned anybody away yet, so it's one thing. I hear stories about some people, it's hard to get in, and I'm like, I'll always take new patients. I never turn anybody away. If somebody's in pain, I'm there to help.
All right, well, it's a form of medicine you may think about trying. Like I said, pain is something we don't have to live with, and I think that's the biggest thing right now is pain is something you don't have to live with, or I guess some people do. Maybe they do. I mean, I'm not going to make that general statement, but we do our best to fight it.
Yes. Absolutely. Basically, you don't have to live in pain, and there are forms of healthcare out there that can help. So.
All right. Well, Dr. Bart Clint here, chiropractor here in Bardstown, and obviously Bart's representing the chiropractic industry. There's several chiropractors in the area and several chiropractors in our viewing audience. We invite you to give Dr. Clint a call or your local chiropractor if you have any more questions. So thanks a lot for being here.
Thank you so much.
All right. Well, thank you. And appreciate you all tuning in, and we'll be back in just a few minutes here on Community Focus, Central Kentucky TV, Channel 6. Be right back.